The super contagious Delta variant of COVID-19 has now spread to 92 countries, according to the World Health Organization. In countries like the United Kingdom, the Delta variant has become the dominant strain, accounting for most of the new daily cases. And in the United States, around 20% of the cases, though the numbers seem to be doubling every 2 weeks. So what does the fast-spreading variant mean for populations that have been vaccinated already, and more crucially, countries that haven't been able to inoculate most of their people? We discussed this today with Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter Medical School with more than 20 years of advising health authorities in communicable disease control and infectious disease management. We also connect with Dr. David Kwak, Professor of Family Medicine and Physician at the Soonchunhyang University Hospital here in Seoul. Thank you both so much for joining us again. It's always lovely to have you both on the show. And let's start with you, Dr. Pankania. Maybe we could start with just how dangerous or just how much more of a risk the Delta variant is and how fast it is spreading.
We expect the Delta variant to become the dominant strain all over the world because it is more infectious. What that means is that it is easier to get infected by the Delta variant, which originated from India, and therefore it becomes the dominant one. The good news is that thus far there is no evidence to indicate that the Delta variant is more severe disease causing or that it is significantly bypassing the current vaccines. So those two things are still in our favor, but the one thing is for sure, it is significantly in the order of about 60% more infectious than the original Wuhan strain that arose in 2019.
Well, authorities are, of course, on high alert, and many countries are reintroducing strong measures against the virus. And well, Dr. Kwak, disease control authorities in South Korea, though, they don't seem to be taking particularly strong precautions to prevent the spread of the Delta variant. And well, in a country like Korea, where nationwide vaccinations aren't going as quickly as expected, with minimal restrictions on social and economic activities, what kind of precautions would you recommend to fend the virus off for the time being?
Well, it's keeping the obvious, obviously. I guess we have to still keep the strict social distancing guidelines and try to cover more portion of the population before we're hit very hard with the Delta variant. But I think the government is currently not doing anything about the Delta variant. They are obviously keeping their eyes on it. It's just that we have very minimal cases happening. It just happened so that within this week, or I think the latter part of the last week, we started having domestic cases of Delta variant, and that's quite worrisome. Everybody knows that eventually we are also going to get dominated with the Delta variant. It's kind of early yet, but I think our government will also come around to implementing much stricter guidelines as to maybe raising the threshold for people traveling in from foreign countries where they're already hit very hard with the Delta variants and whatnot. But at this time, I think the best we can do is trying to vaccinate as many people as possible, and also to keep strict social distancing guidelines as well.
And Dr. Pankania, there's a lot of concern over whether this new variant could perhaps reverse much of the pandemic progress that has been made in the UK and the United States. What are your thoughts on this?
The Delta variant per se doesn't look like it is bypassing the vaccines. Therefore, it is unlikely to reverse the vaccination program and the progress made by immunizing millions of people. Having said that, this is a clear warning signal for all of us, which is that because we have runaway, uncontrolled, large infections and outbreaks in Africa, Asia, South America, etc., and no immunization and no suppression of infections, a new variant could arise. And this new variant could easily, if it was very unfortunate, be one that bypasses vaccines, or one that causes much more severe disease, or one that affects younger people much more. So all of those things are something to be really worried about on a global scale.
So authorities really need to keep an eye out for the long-term implications. And, well, Dr. Kwok, with the evolution of the COVID-19 variants, some say that the target for herd immunity needs to be raised to at least 80%. In some countries like Switzerland, they're planning to raise their goal. Would your views be in line with theirs? What precautions do you think should be taken, even among mostly vaccinated populations?
Well, yes, I agree with the idea of raising the goal of herd immunity to something beyond 80%, because I just recently had a chance to have a conversation with a doctor from Israel, and they reached far beyond 80%. They're, I think, almost reaching 89% at this point, and they were still having 160, 170 daily cases, and they were also having intrusions from Delta variants. So it means that even if we reach anything far beyond 60 or 70% that we set our goals originally at, and it still means that we're still going to be hit by these new variants, let alone just the Delta variant. So setting the goal much up higher to vaccinate most of the population as much as possible, it would be much more protective for us against any of these new variants. Now, that being said, I think it's about time that we also start seeking other methods of protection, as in cure regimen, maybe oral pills that has great potential to, let's say, eradicate virus and whatnot. I believe, to my knowledge, there are a couple of options that are currently being studied that are showing great results. So I think solely relying on vaccinations at this point is maybe hitting a plateau of protection because we're uncertain yet at this time how much more of a global population that we can reach in short amount of time with the vaccination rate. So we have to seek other methods of protection as well.
Right, so some advanced countries, they're talking about 70%, 80% and even beyond that. But in countries across Africa, according to the WHO, less than 1% have been fully vaccinated, Dr. Pinkanya. How is the Delta variant affecting people in countries that are currently behind in vaccination efforts? And what risk does this pose for them?
This is something that we should be ashamed of in Europe, where I live, because we have raced ahead with immunizing our population, and yet in Africa about only 1.5% of the population has been immunized. So we will give rise to variants. It also doesn't feel comfortable that we have not looked after the African nations and supported them and allowed them to set up plants and manufacture vaccines and give it to their population. So it is really a big failing on the global scale with regards to helping Africa and also controlling the outbreak. And if you don't control it, new variants will arise inevitably.
And Dr. Kwok, also for the people who have been vaccinated or are about to get the vaccine, several studies have shown that mRNA vaccines are more effective against the Delta variant, and that adenovirus vaccines are substantially effective after the second shot. So what does this mean for people who get one-shot vaccines?
That's actually a tough call for me to make at this point, because not enough study has shown us exact results, exact numbers of how effective these Johnson & Johnson Janssen shots are, or some of the other or viral vector type vaccines are. As far as we know, it seems like AstraZeneca shots are able to protect us up to about 66% of symptomatic disease upon completion of both the shots. And also, as you said, mRNA types offer much better protection. I don't think any government or government agencies are considering inoculating booster shot right away, but because we would have to make clear of safety issues first, that make sure that it is safe to use cross-matching vaccines to people to boost their immunity. So, but once that is cleared, I think offering these cross-matching vaccines to people who's already been shot at least once with the viral vector shot will provide much broader spectrum of morphological antibodies. So it will help, theoretically speaking, it will help provide better protection against new upcoming variants or already existing different types of variants. So as long as it is proven safe to use, I am all for using cross-matching vaccination program to people who's already been shot once or twice with the viral vector type of vaccines.
And Dr. Pinkanya, there's a lot of conversation in the US around when the right timing is for booster shots to be taken. But some are saying that, well, is it the right time to be talking about booster shots when, as you mentioned earlier, much of the global population haven't been vaccinated? What would you say? What would you add to this discussion?
Yes, so the United Kingdom government has announced today that they are going to give booster shots of the SARS-CoV-2 vaccine in the autumn this year. My personal opinion is I would much rather immunize the unimmunized younger age group people in the country, in other words, 12 years and above, instead of going down the booster route. However, we know what we know, and we don't know what we don't know with regards to how the government makes these decisions. They may have decided to do the boosters in the United Kingdom because they have got extra supplies of AstraZeneca Oxford vaccine, whereas they haven't gone down the school immunization route because they have not got enough supplies of the Pfizer or Moderna vaccines, which is what they want to use in the under 40-year-olds in the UK.
And Dr. Pinkanya, you mentioned the possibility of the mutations of the virus continuing. How and where do these significant mutations tend to happen, and is there a way to stop them?
The best way to stop them is to have control over number of cases. These RNA viruses, the SARS-CoV-2 is a RNA virus. The more they multiply, the more mistakes they make because they haven't got a checking mechanism. So what we want to do is suppress infections. And by suppressing infections, hopefully we also suppress the evolution of a mistake, which then turns out to be an advantage to the virus and a new variant arises. So what we have to do is suppress infections any which way, which is with the vaccines, with infection control measures, and we've talked about finding therapeutics. So if we can find a drug that can block the virus's activity, that may also be a great breakthrough. And I know a lot of work is going on in finding drugs that may be able to block the infection from the SARS-CoV-2 virus.
Well, I'm afraid we're out of time today, so this is where we'll have to end the interview. But that was Dr. Bharat Pinkanya, Senior Clinical Lecturer at the University of Exeter Medical School, and Dr. David Kwak, Professor of Family Medicine and Physician at the Soonchunhyang University Hospital in Seoul. Thank you both so much for your time.
Thank you.
Thank you.
And to our viewers, as always, thank you very much for watching.